Home for more than 3,000 elderly Chinese, all aged over 60, this retirement community in West Beijing is a microcosm of the larger elderly society in China. Wang Shuhua's husband has been sick for 21 years. The couple has no children. Wang is constantly stressed about the costs of in-home care.
Our care worker gets paid 2,800 yuan a month. During Spring Festival, it's 3,500 yuan. But my monthly pension is only a little more than 2,600 yuan.
Many elderly residents in this community have chronic diseases and need daycare or in-home services. 75-year-old Ma Zhongyuan says it was when she couldn't move that she realized how inconvenient her life has been made by the neighborhood's lack of facilities catering to the elderly.
There's no clinic in this community. I needed to get my flu shots, but I couldn't move. I called the neighborhood's hospital and asked them if they could send someone. Nobody wants to come.
While many elderly choose to live with their children, there are also empty nesters like Qi Jinzhi, who lives alone. She feels elderly's need for spiritual enrichment has largely been neglected.
My children once took me to a tour at a care institution, and I felt terrible. Although the facilities are top-notch, it feels like prison to me.
Here in China, nursing homes nationwide provides about 5 million beds, enough for only 2.5% of the country's elderly population. Part of the reason why so many elderly Chinese choose home-based pension support, like this family. But the country's home-based care service is far from meeting the demand. So here comes the question, what can we do about it? I took that question to Professor Dong Qiuyuan, a member of a think tank for pension policymakers. He proposed a three-care system.
Food supply and healthy supply and also the culture care. It's a three-care system. If we want to set up this three-care system, not only rely on individual, rely on the family, rely on the community. We need a government policy to support this. Also, we can use some public-private partnership, PPP.
Recently, the Beijing government passed a regulation on home-based care for seniors, the first legislation of its kind in the country, scheduled to take effect on May 1st.
The government is responsible for building the platform. Once that stands, service providers such as restaurants and nursing facilities could settle in. They could provide services to the entire community and door-to-door service for the elderly.
Finding a way to provide enough care for China's elderly would test the wisdom of both society and the government. And for elderlies like Zhou Xiaoping and her neighbors, how these policies can be translated into real action so that they don't have to worry about taking care of their basic needs is the big question. Qiuyuan, CCTV, Beijing.